launch in and tell us what you do, and go ahead and do your PowerPoint when you're ready.
Okay, I shall.
All right. All right. Thank you.
I started from the beginning. So I'm Regina Bonnevie Rogers. I'm a general internal medicine by training. I went to George Washington University for medical school and University of Colorado for internal medicine. So I'm a general internist, which is kind of a rare breed, I guess. I'm not quite sure anymore. I've been with Peninsula Community Health Services, or if you see a lot, it's PCHS. It used to be called Kitsap Community Center in the past. But we changed, as Lenny was saying, all this changing, and it's all about brand at some level. That's kind of my background. I love chronic disease management. I see a lot. I'm more of a geriatrician in my heart, and so I see a lot of Medicare patients. So I'm just going to kind of introduce who we are. So our mission is providing accessible, affordable, quality, and wellness services for our communities. And what we say now is just not used to be. In the past, we were just in Kitsap County, but now I will show you our map where we're at. We're also now in Mason County, and we're about to open a clinic in Pierce County and Key Peninsula. And our vision is to limit healthcare disparities. We're really in all about equity and social determinant of health aspect to care, whole person care, and our core values is patient-driven, empathetic, and respectful. And our guiding principle of our clinics is see and value every person. And I'm very open. If you have any question in between my presentation, please put up a, please intervene. I'm not at all like this to be more of a conversation. So we have been around since 1980s in Kitsap County. We started off as a small kind of local initiative in the 1980s when several community members noted that there was a lot of care that wasn't being met with the underinsured and uninsured. So we started with a small clinic up that was helped with the local health department and other community members. Started with up downtown Bremerton on Pacific, right there. And I can still remember the building is still there in the second floor with a part-time MD and a nurse practitioner. And then in 1993, we were granted a status and funding as a federally qualified community health center. And in 2013, we're accredited for being a patient-centered medical home, as well as a high-quality primary care. So this triple HC is akin to JCO for hospitals. So we meet a certain level of standards that we have to, and they audit us every 3 years. Who we are, we are the community. We do a lot of things that I will be explaining to you. We've been here since 1987. We continue to grow and expand based on the community needs. And why is because it's what we do and what we want to serve the community in terms of their healthcare needs, as well as other needs too that we're starting to expand. And we're very team-based approach, holistic, integrated, and very collaborative with other services. And we pivot quickly as Jessica, when the pandemic hit, we became the testing site, and we morphed some of our provider teams to be the testing site, and we tested over 40,000 patients or community member. And then when the vaccine started in December of 2020, we started doing vaccination, mass vaccination, and I think we provided about 50,000 shots. And it just kind of, this is what we do and where we've been, what we've been going. Trying to minimize my. So we just are everywhere, been here for almost 35 years. I've been with Peninsula since 1999, right out of residency. So I was just a regular provider, and I became the chief medical officer about 10 years ago. So we do a lot of kind of support of our patients. So this is kind of a really neat perspective where we're our location. As you can say, our most northern clinic is Poulsbo in Kingston. Then we have a clinic in Silverdale, then 2 clinics in Bremerton, Port Orchard, Belfair, and now we're about to be in Key Peninsula, and we do have a clinic in Shelton. So we have also mobile services. We have several mobile clinics that you'll probably see around that says Peninsula Community Health Services. We're also embedded in some of our partner places like Salvation Army, Kitsap Rescue Mission. We're also now at the school-based clinic in Central Kitsap, North Kitsap, and Bremerton school districts. And then this is kind of a cool thing, a really awesome provider created that I wanted to, if I can make it work. It's really quite where we're located. So I can, so here's our regular medical clinics. I can just turn off things and show you where our main big clinics are. So these are all the clinics, the big clinics that has medical providers, behavioral health providers, some dental providers, so forth. So that's just the traditional clinics we have. I'll show you where our...
Let me interrupt you a minute.
Sure.
What we're seeing is the slide.
Oh,
so
you're not seeing my
Google
wonderful...
map.
Oh, that's too bad because the map...
So I think you'd
really
have to share a different screen to make that work.
I will. I thank you for that. I think I will do that. Oh, there it is, because it's so cool. There. Can you see now?
Yeah.
Thank you. Here we go.
I think you have to stop sharing once. Yeah, there we go. Now we can see it. Thank you.
Okay. So this is where we're at. Location. This is our traditional clinics. From Poulsbo here to all the way down to the Key Peninsula, that's we're opening in November 17th, to our Belfair clinics. So that's where we're at. This is a mixture. So that's where the traditional medical. Here is where our school-based clinic is located. Barker Creek, Clahalia, Esquire, South Kitsap High School, North Mason High School, Fairview, and Mountain View. And then behavioral health is where we have several within our clinic, as well as embedded in some of our partner clinic like Agape. And in pharmacy, we have Class A pharmacy. We do dispensarying on these kind of places. So this is just amazing that we have how much we've grown. And this is where we have outreaches and connection. We're at the Kitsap County Jail to assist patients who have substance use disorder issues, and we treat them with Suboxone as needed when they get discharged from the jail. So I hope that's helpful in terms of location. I think that was one of the questions. I'll go back to my presentation.
Yeah. Did I hear you right that you don't have one at North Kitsap High School, a school-based
Not
clinic?
yet. We're in conversation.
Okay, thanks.
Our first one was at North Mason High School, like about, I would say pre-pandemic. We started that in 2019. And then the Central Kitsap then wanted to, have us there and so forth. So it's just kind of expanding. So our patient population, we've in 2020, because we're a fairly qualified community health center, we have to provide demographics and quality measures to HRSA yearly. So this is from the 2020 population. We served about 35,000 patients, about 23% are pediatric, and older adults was about, I'm sorry, I thought I wrote that down, we have about 20% are pediatric. I mean, Medicare, I have the number, sorry for that, is older adults, we have about 10%. And then adults between 18 and 64 is the bulk of our patients. Insurance status is noted there. We have a majority are Medicaid at 58% and Medicare at 12%. We still have an uninsured population of about 10%, and we do a sliding scale for them because we're a fairly qualified community health center. And we have 20% of our patients are third party, like Regions, Blue Shield, Blue Cross. So the bottom line is we take anyone who would like to be seen at our clinics. Anyone, all comers. These are our services, and I know we wanted to really focus on the family planning reproductive services that we do. But the key is that we just started our own obstetric gynecology program in about 2018. We have 4 OBGYNs now in our clinic system. And we have a very growing behavioral health team also, and dental. We do not have urgent care. What we have is extended hours, where we extend our hours in some of our clinics to 8:30. But we do not have a urgent care where you could do a stat lab or x-rays. And then we have this really kind of unique services that we have that a lot of people do. So these are our mobile clinics. So that's a dental where we actually, would be pre-pandemic, our plan was we were going to just go to the schools and say, hey, anyone wants to come by, we would do service, dental services in the van, or in a, that's really more like a RV. And then this is the medical RV we have. And then we also have behavioral health vans also. And as I said, we are in different places and partners. We do a lot of health fairs, farmers market. We just park our vans to do some screenings, blood pressure and things like that also. So if you see anything with trees, that's Peninsula Community Health Services. That's our logo. Other services, we have interpretation service for all languages. We have this, it's video, televideo. So you just press the language you need and a interpreter will be there. We use this kind of like Zoom type interpretation. Also, we have in-person interpretation if the patient would like to have someone in person. We provide some transportation. You'll probably see some vans that we have. If patient has difficulty getting to a specialty places, we'll try to help them, especially if they need a colonoscopy or something like that. And we have insurance navigation. We do Medicare insurance and any of the new like Apple Health type of coverage. And then we do a lot of social determinants of health screening, and we provide some resources. We actually have a food treatment where we can provide patients who identify they have some food insecurities. We'll give them a bag of food, and it was through a grant. And the infant toddler supplies is through a baby corner. So we're able to give our new moms, even help them with a car seat, the strollers, or whatever is necessary, diapers. So we have a little bit of that grant money that we've ever used. And then the rest are just resources where we do not have housing as of yet. You never know. Providers, we have family medicine physicians, internal medicine like me, pediatrician, OBGYN, and we have a lot of advanced nurse practitioners and certified physician assistants. And then we have like a psychiatrist, counselors, dentists, hygienists, the usual. Pharmacy, we have clinical doctors of pharmacies are pharmacists. They're all very clinical. Right now we have over 30 providers, medical providers, about 15 behavioral health providers. Dental, I think we have about 15, and pharmacy we have about 8. And so here's kind of the services we provide for reproductive and women's health. We are the one of the family planning providers. So we do a lot. We do a family planning screening questionnaires for every adult patients and identify, you know, their wish to be pregnant or not pregnant, and provide the needed services. We do oral contraceptive pills, Depo, Nexplanon, IUDs as needed. And we do counseling of pregnancy options. Then, of course, we have the obstetrical team now. And then we do gynecology stuff as needed for that. And then we do a lot of preventative wellness, women's health care. End of life care, as you know, Medicare wellness visit is really being a push for us. And during that time, we discuss advanced directive counseling, and then we do refer for palliative and hospice care. And that's, as an internist, I do a lot of this particular care personally. And that's it. So I'm open for any questions. And I will unshare.
Thank you. Yeah, if you unshare your screen, we can get back to, I'm going to actually, I hope, change the recording view so we have the gallery view now. So once again, remember, if you don't want to be recorded with your visual, then pause your video. So I had one quick follow-up question because I'm embarrassed. I don't know, do we have hospice facilities in Kitsap County that you refer people to?
Yeah, so it's mostly home hospice. So most of the hospice program, they go to the homes. And so there's several, there's Kindred, there's the Franciscan system, and there's Providence system, as well as multi-care. So the referral process is really based on the coverage of the patient, what coverage they have, and what company has contracted with that coverage. It's kind of always kind of sometimes the limiting factor, to be honest, with referrals.
Thank you. Are there other questions? Pam, unmute. Unmute, Pam.
I'm following up on the hospice. Is there distinction between the Catholic-run hospice and the secular? And do we refer accordingly?
It is all based on patient desire, which one they would like to go to.
So you tell them that there's a choice there.
Yes, absolutely.
And
then, I'm sorry, go ahead, ma'am.
What is the name of the secular one?
Kindred.
Kindred.
And this is kind of it's an hospice of palliative care and hospice. They're kind of all in together. And multi-care. And I know that they have different, each programs have different philosophies of care. But it's all really
protocols too.
Yeah, it's different patient. It's very patient-centered. What the patient would like to do, as well as I said, it's all about coverage also. Insurance coverage.
Carolyn.
Thank you. I'd like a follow-up on, thank you very much for the presentation and the services that you provide. I have a follow-up on the hospice care in Kitsap County, and how informed are your patients if they say they want to have options for death with dignity?
So as you know, there was a law that was passed for death with dignity, and right now we're in the process of developing our protocol. That is just something that it's a conversation within the provider's patient evaluation and assessment, especially with Medicare wellness visit, because as they get older, or if someone has cancer or things like that, that should be a conversation that should start.
And particularly, do you inform your patients that they will not be allowed to have death with dignity through the faith-based Catholic systems?
That we are only focusing on what PCHS is able to do for them, and we are open for that. We are in compliance with the death with dignity. That's one of the options, and we're in the process of creating a protocol for our providers, how to approach that.
So I think, Rachel, you're next.
Thank you. Hi, thanks for your time today too. I actually had a follow-up about the family planning services. You mentioned that your facilities will do pregnancy options. Can you elaborate what those are, how you help those pregnant patients?
Yeah, we because of the Hyde Amendment, because we're a federally qualified community health center, we're not able to directly facilitate termination, but we are able to provide all option and do referrals. Is that did I answer the question?
Yes.
Carolyn?
Yes, thank you. So in your clinic, if you have somebody that needs to be referred for hospital care, that goes beyond your clinic capabilities,
Mm-hmm.
where do you refer your patients?
Well, there's only 2 hospitals that are close. So that's St. Michael and St. Anthony's. Our provider is privileged as courtesy privilege at St. Michael's. Historically, previously Harrison.
Mhm. So when you talk about providers, your providers, your physicians.
Yes,
and
our physicians,
providers,
correct.
they have hospital admitting privileges?
Not anymore because, as you know, St. Michael's uses hospitalists as well as laborists. So the only one that truly goes into the hospital now is our OBGYN, because they do surgeries, they do deliveries. But in terms of internal, regular, if your patient is in there for pneumonia or COVID, the hospitalist takes care of them.
Okay.
I have another question, sorry. So if you have somebody come to your clinic, a woman who says that they would like a pregnancy termination, what do you do?
We refer them out because, as I said, the Hyde Amendment, we cannot use any federal money to facilitate that directly, but we do refer them out if they need that, like Planned Parenthood.
Okay, where do you refer to in
Planned Parenthood?
In Kitsap County?
Correct.
Okay, thank you.
Pam.
I'm just curious at how often does something like that happen where a young woman asks for access to an abortion? How often does that happen?
That is so private that I can't give you a number. And I'm an internist, so I see mostly like 50 and above, or that's a very kind of HIPAA. It's very, and we don't like do a data on that because it's so private and confidential.
Okay. I guess I'm also asking, like Lenny, is you said you're in discussions with the North Kitsap School District about having a clinic there. Several of us live in North Kitsap and see the value in that. And I guess I just want to have a feeling whether you think they might be receptive or if community members can influence that.
Oh, of course. It's, we have to work with the school district, of course, and their board. I think COVID has slowed that conversation down. The pandemic, being out of school, the virtual kind of thing. So I think that's why it's not as fast, is because of that. I think they're very receptive. It's just all about the logistic. We have to have a clinic within the school. So kind of trying to figure out all those specific logistics.
Well, I was wondering too about the cost involved. Does that the school district have to cover that, or is it? How is that covered?
We just need a space, and then we provide the provider.
Okay.
And everything else. All we need is a space.
Wow,
okay,
that's great. Catherine, did you have a question?
Yes, you said your providers, or you were having a discussion about death with dignity or end of life. Is your goal to have some of your providers provide that service, like, having to say, yes, this person only has 6 months to live, and yes, this person is psychologically okay, which I always wonder about whether somebody would say that about me, but but anyway, and then be able to prescribe the medication. Would it cover all of those?
As we're developing it, yes, whatever is in the law.
Okay.
We are patient-centered, and if it's appropriate from each provider's perspective and they feel, it's appropriate and indicated, yes.
Okay, good.
So Lenny, you're on mute, but I think Carolyn has had
Sorry.
her hand up.
Yeah, I think Carolyn is next. That's what I was
Yeah.
trying to say.
So I had a
Lip
question
read here.
about services that you provide to your LBGTQ plus and trans community.
Mhm. Yes, we do a lot of, in fact, I have the beauty of our electronic health record is that we're able to determine, you know, their what is their pronouns, would they like to be called, all that. I have like even me, I have about maybe a dozen trans patients, as well as you know, in questioning, and I've done some hormone therapy for some. So we're very much open for that.
And surrogacy, anything like that for a
I'm
couple?
sorry?
Surrogacy or other?
We don't do that. That's just
yeah.
not in our bandwidth.
Mhm. Jessica, you want to go next?
Sure. So Dr. Bonavie Rogers, I'm sure that you all, I'm making assumptions, you know, see patients from a wide variety of cultures.
Yes.
So I was curious how that plays out with reproductive health service counseling, and then with end of life counseling. How do you incorporate the cultural competency piece?
It has to be. I mean, yearly we do cross-cultural training for all our employees of over 300 to understand that. A lot of it's language, so we want to make sure communication is understood. So anything that's needed, if they're non-speaking, English-speaking patient, we want to make sure there's that conversation is language appropriate. And then and because we're the family planning clinic, we have to go through some training with the state in regards to that kind of cultural, traditional, and you know, how to approach all that things. So we try to train providers, but I'm not in the exam room each of them. So we do our best.
Yeah, at least you do the training, which is really important. Evie.
Very important to us.
Yeah. Thank you. It took me forever to find the raised hand. Old, what can I tell you? I have two questions for you. And one is, so your pregnancies, where do you refer them for delivery? And two, do you have psychiatric counselors, or do you refer that?
For deliveries to St. Michael's, again, that's where our labor and delivery is located.
Okay.
Unless they are very high risk, because they, you know, there's a certain level. If the newborn needs something a higher level, they might need to go to Seattle, to Mary Bridge, you know, or Tacoma. So it depends on the complexity of the pregnancy, where they might deliver and who's the provider. In terms of psychiatric nurse, yes, we have a very integrated behavioral health. We have psychiatric nurse practitioner and psychiatrists in our system.
Thank you.
Mhm. I want to ask a question and then I'll go to you, Pam. When you're talking about the system and you have quite a few clinics,
Mhm.
do you have, I know you don't really have specialists in the sense of cardiologists or whatever, but do you sometimes refer people from Kingston to a bigger clinic in Bremerton because there's a physician there who can take care of them?
Yeah,
You
yes.
refer in the system.
We call that internal referrals. So, you know, so for example, a family practice provider, whether it's a MD or a nurse practitioner or advanced practice clinician, feels that a patient is much more, you know, better suited for a pediatrician to see them,
Mhm.
or vice versa for an adult patient that's more complex. Maybe I, as an internist, may need to see them. So we do like internal consultation. So we'll just
Great.
directly schedule those patients as, you know, as appropriate to those appointment times, if there's availability. Then there's the OBGYN, of course. That's the new specialist we have, is for any kind of women, you know, abnormal bleeding. So of course they have to evaluate that and so forth. So that's our new specialist. And of course, psychiatry, you might think it's a specialty, but really for us, it's really integrated in primary care now. It should be part of primary care.
Good. Mm-hmm. Pam.
I've been around since the 80s, and I am so impressed with how Peninsula Community Health Services has expanded. It's really wonderful. But with that in mind, it seems like the services are really pretty good in Kitsap County. I wonder if there are any gaps in service providers or specialties or whatever you see in the county that really needs to be filled?
From my own personal experience in looking at our referral utilization, dermatology is a very hard specialty to acquire and get, and sometimes it takes like 6 months, 3 to 6 months to ever get in. It used to be pain specialist was a little challenging to get sent to. I think our OBGYNs are really, now that we have our own, it's not so difficult for reproductive and women's health is easier. We don't have in any place here is neurosurgery. We have to send that out to Seattle, UW. But other specialty is pretty, from PCHS, we've not had any difficulty. We've had good partnership with the specialty groups.
How about geriatrics? Is that pretty well covered?
Yes, pediatric is pretty good, especially in the North End and Silverdale. I think they seem to be mostly there.
That's great. It really is great.
Did you have another question, Evie?
Oh no, I just found Lola.
Okay.
Sorry.
Okay. Carolyn.
Thank you. Yeah, I have another. I'm curious about the referrals to St. Michael's for labor and deliveries. And I was wondering, for the low income women and families that need to go there, how are the costs handled? And is there charity care that covers the costs of that referral? And also, if during the labor and delivery, if they can get tubal ligations either during a C-section or not during a C-section.
So in terms of coverage, every pregnant woman is covered. So usually that's not an issue because I think it's a Washington state kind of, from expansion of Affordable Care Act. So there's never been an issue with a pregnant woman, and Jessica can answer or concur with me. So there's never been an issue with that in terms of coverage. But that's the only place that has labor and delivery in Kitsap County. So it's St. Michael's, or they have to go all the way to St. Joe's or multi-care. So those are the process. I think in terms of it's necessary to, I haven't heard anything from my OBGYNs whether they can't do tubal ligations. So I can't speak personally on that. They have not mentioned that it was a difficulty.
Thank you.
Okay. So it's dependent on your OBGYN will deliver patients at your OB at St. Michael's.
Yeah, so we only see our established patients, and we're all, and then at the hospital, whether it's regular care instead of OBGYN, there's a county call. So there's when patient has no primary care provider, then it's shared throughout the whole medical team. And then they take turns every day. And then if there's a patient that is not have a doctor, then the county call provider is the one who takes on that patient as an inpatient.
Got it. In general, go ahead, Jessica.
Does PCHS have any relationships with some of the nearby birth centers? So I live in Paulsbo, so I drive past, I think it's called True North Birthing Center pretty often.
No, we have not. This is a fledgling program.
Gotcha.
So we're just our two women OBGYN just started like 4 weeks ago.
Oh, wow.
We're so trying to add midwifery and, partnership right now is going to be a little challenging. We just want to really create good protocols, high quality care and delivery for that within that OBGYN kind of process. So.
Yeah, that's a follow up on that same question. In general, it sounds like you've been able to expand and find the providers, whether it's a nurse practitioner or a MD or DO or whatever, when it's pretty clear that the need is there for that expansion. So adding OBs, clearly there was a need. Do you have any sense that there might be challenges to any further expansion? Are you having any difficulty, say, this new clinic that you want to open down on the Key Peninsula, and are there other areas where you feel like, oh, we might need a second clinic in Paulsbo or somewhere else?
So I don't know if you've, because of the pandemic and COVID, there's a big, it's called a Great Resignation from just generally providers. And that includes medical assistants, ancillary staff, nursing. And some providers are just getting very fatigued and tired. So there's a lot of movement. And right now it's very challenging for with medical assistants and dental assistant to get. So that's kind of, for us, is the limiting factor, is the ancillary assistance. It is not just in Kitsap County, it's everywhere. And then it's becoming more competitive, because even certain, like the restaurants are having issues. So now what they're providing higher wages. So then that's competitive for, like, I think some places are giving $15 an hour to $20 an hour in like McDonald's or something. So that's going to be interesting, but there is definitely a nursing shortage. And I think that would be going to be, people are going to start seeing that. And it's everywhere in the United States of America because of this pandemic.
Yeah, I was kind of worried about that. I think it's harder in the rural areas. And so some parts of the county, it's easier to attract physicians to, Bremerton or Paulsbo or Silverdale, I think, than into
no, they like to go to Seattle and Tacoma. Yeah. I mean, so the harder one are psychiatry is very hard, as well as now it's getting harder to do mental health. It's professional, because with the pandemic, it opened up televideo visits. So a lot of companies are becoming just direct, very much just tele doctors or televideo visits instead of in-person visits. So that's kind of the ramification, or whether you see it as positive or negative with this, is the utilization of that. I think there's, in my opinion, with televideo, there's good possibility for it, but I think in person and really seeing the patient, and there's something lost with a Zoom meeting. I've been doing Zoom meeting forever, and I would like to see people in person. So anyway, so that's to answer, yes, it's going to be an interesting few years in terms of staffing.
Carolyn.
Yeah, to follow up on that, does I get this, PCHS offer telemedicine, since I believe there was a law passed this last session that amplified the options?
Absolutely. So when the pandemic hit in March of 2020, I think that was correct. We had telehealth process up and running within a week to see patients that were actively symptomatic and minimize exposure to our other clinics patients. So we use Doxy.me. So we're doing telehealth, but we never closed our clinics to in-person, because some of our patients do not have the bandwidth with computers, ability with Wi-Fi. It's not, people say, oh, it's just so easy to do this. That's not true. There's areas where there's no Wi-Fi. There's people have no computers. I mean, the phone is amazing, but that's what we told them to use if they had to do televideo. So it's a wonderful, I think, added value, but I don't think it's the best way to just do care.
Right.
Thank you.
Pam.
I'm curious, do you interact at all with Olympic College nursing program or any of their other health programs?
Yes. We're doing a collaboration to help with getting some licensed mental health professionals program. And we work with, we have a lot of external medical assistants. We have our own apprentice program. We do medical assistant and dental assistant apprentice program, because we realized way ahead, even before the pandemic, that we need to grow our own and teach our own. And we're starting to do a psych A&P residency program and a dental residency in pharmacy. As you know, there's a residency program for family medicine that is connected with Virginia Mason Franciscan system. So we are not going to replicate that because that's very complicated to do. And we have always a lot of physician assistant and nurse practitioner doing their externship with us, and they become our providers. That's why it looks like it's easy to recruit. It's not. It's very intensive, time consuming, and that's part of my job as the chief medical officer, is to do that. It's a lot of work. So we really work on retention and utilizing workflows, and as someone say, work smarter, not harder, by utilizing team-oriented care is what we really approach that. Because our patient, as you know, is very complicated with their social determinants of health issues and other things.
I have one question. You talked about using a translation service that's electronic, for lack of a better term.
Yes.
Which I think can be a big advantage, because one thing that I confess I did not know how many people there are. The non-English speaking population in Kitsap is not huge, but it's growing. And many people say from Guatemala or Honduras, they're not Spanish speakers. They speak a Mayan dialect.
Yeah, they speak Mom, which
Some.
is Mom. It's very hard to,
Yeah.
it's M-A-M. And so what we have to, and we're very lucky that we have a few of our staff, and there's a majority of them are in Belfair area and Wheaton, Bremerton area. They came because they're brush pickers, which is the Salau. That was kind of the start of the community coming over here. So sometimes you have to translate from Mom to Spanish to English. Sometimes there's a triple translation. It's quite challenging, but it's important for us to have that. We have a pretty robust population.
That's great that, because I was not aware that a lot of translation was available for people who didn't speak either Spanish or English, for that matter.
And some, one of the problems sometimes is that sometimes the specialty clinics do not have that ability. And that can be a challenge. So we try to help as much as we can with that.
Good. Thank you. Are there other questions? Pam.
I have another one. Are the physicians at the Peninsula Community Health Services, are they active with the Kitsap Medical Society?
Yes, some of them. In fact, my chief, my CEO is a pharmacy by training, a doctor's for pharmacy. We're very involved.
That's great. It seems like the whole medical community is well mixed or well organized. They are a community. It's really grown over the years, that's for sure.
It's changed a lot in my last 20 years. And I've seen, I kind of miss the old Harrison and Bremerton. That's where I used to be a traditionalist internal medicine, where I actually rounded on my patient in the morning and then went and saw a clinic patient. And that was kind of what I did maybe 15 years ago. Still, now it's medicine has just evolved, and it's just different now. And so fast, doing inpatient medicine is different than doing outpatient medicine. So that's kind of the reason it's morphed into this kind of specialty, being all in the hospital versus being in the outpatient. It's just very complex.
Carolyn.
So I was wondering how you do outreach for our homeless population who may be reluctant to come into or search for medical care.
We're at Salvation Army and the Rescue Mission. And then we use our mobile clinic to go to certain areas where we know there's homeless community that's unsheltered. So we utilize the mobile clinic. That's why we have expanded that. So we go to where they are located. Because some of them, it's interesting because our 6th Street clinic is literally 2 blocks from the Salvation Army. like literally, and they still don't, there's something that holds them back from going inside our clinic. So we go there. So we're there at the Salvation Army every day to do primary care as well as behavioral health.
Thank you.
Anne,
Yes, I know that you also come to Fishline
Yes, thank you.
regularly.
So
Are
many,
you
so
there-
many partners. I have a wonderful associate medical director that Tony Lyon Loftus, who's a physician assistant, that his main part of programs is the mobile clinic and outreach clinic. And he's been amazing creating partners. We've been at libraries. We've been at any places that they invite us. We'll go there and park our mobile clinic and do whatever is needed.
that's great. Jessica, you
Oh, just a comment. I mean, also PCHS, I mean, they also worked with the health district in the county with, the quarantine center also and
Oh, the
referrals there
Q9,
too.
thank you.
Yeah, the quality, quarantine and isolation. So it's just been amazing how nimble and flexible PCHS is.
Yeah, as I said in the beginning, I mean, we're really here for the community. So whatever, so I think one of the difference that we have as in our clinical system is that our board of directors, being a FQHC, 51% have to be patients of ours or parent of patients. So that's 51%, majority of the board are patients. So they are the one, and then 49% are community leaders to balance, like accountants, after we have a hospital, and then a health department person and a Kitsap mental health, admin staff. So we try to mix it up, but 51% have to be patients. So any services or any kind of programs that we will do have to go through the board of directors and be approved. So it's very patient-centered. I mean, they will tell us that this is what they saw when they went into the clinic.
Anne, did you have another question?
Yeah.
I'm curious about what the situation is in Kitsap County with opiates, particularly fentanyl, and how is that being handled, or is it being handled? Is it a huge problem here or not so much? I mean, you read about it, but I don't know specific to Kitsap County.
So we were lucky to get a really amazing grant to become a medication-assisted treatment program in primary care, and they call it MAT, or used for Suboxone. So we've been doing that for the last 5 years. So we've been doing addiction medicine, especially opioid use disorder patients. So we've been treating them with Suboxone or Vivitrol for the last several years with our substance use professional, but it's the primary care provider that does the prescription and sees them and monitors them weekly in the beginning, then monthly, and whatever's needed. Unfortunately, fentanyl is coming to our side of the sound, and that's a much more difficult treatment plan to treat patients addicted to fentanyl because it's so super dangerous, and there's a very complicated thing, but we've been doing it. We're one of the biggest clinic, I think, that does medication assisted treatment for opioid problems.
Anne, did you have another question?
Yes, I just wanted to make a comment and then maybe a question also. One of the things that I love so much about your mobile units, I love how they're painted so beautifully. They just really stand out. But I also like the fact that they take walk-in patients too. So at Fishline, that's really an important thing. You can make an appointment and go in. And it seems to me like, from what I understand, you have full facilities there. You have a lab. Mm-hmm. Do you also have X-rays available in the van at all or not?
No, we don't. We do not have X-ray. We just.
But you do have a lab, correct?
Yeah. I mean, we draw the lab and then we'll send it off if it's something that needs to be sent off.
Right. So you have the ability to do that. So to me, it's almost like one-stop shopping, and it just makes it so much easier because we do at Fishline have so many homeless people, so many kids sleeping in their cars, so many people that just really just don't have anything. So I think I just really applaud you for that. Thank you.
No, thank you.
Carolyn?
Yes, thank you. So it just sounds like you have a huge patient base that you've developed over all these years. And I was wondering if there's any plans in the future for possibly establishing your own acute care hospital with a certain number of beds.
Don't give my CEO an idea.
Well, I think it would be a wonderful idea because it would certainly give options to citizens of Kitsap County.
And yes, I think right now we're mostly going to be outpatient service. Kind of, it's what we do very well. But that's, I wouldn't be surprised, but I don't know if it's going to be in my lifetime. I don't know. It's complicated. But there's just so many, even just outpatient gaps are still out there to really meet. You know, the pandemic, I think, just kind of really underlined the importance of always being available and doing, you know, being where the patients are with mobile clinics and being kind of providing care in a different way. But duly noted, I will not mention this to the boss, to my CEO. When she gets an idea, it could be problematic for everyone else, her staff.
Yeah.
Oh my God, this is recorded, isn't it? Oh no, can we have that muted?
Evie, did you have another question? Evie?
Okay. Are you treating sexually assault patients or do you refer them? And also, I have to say, as a psychiatric nurse, it sounds like I could get a job, but I'm old.
Yes, in fact, we've been, one of our behavioral health director really focuses on you know, sexual assault and sex trafficking. Bergen Stark, she's been with us for a while now, so it's really been a priority, and she's been doing some training with our provider team on identifying that and having that crucial conversation that is sensitive, as well as, you know, for them to get trust and let us know that there's something going on. In terms of what we have to do, we have to send them to the ER for specific testing.
Right.
But if it's just basic testing for any STDs and so forth, we'll take care of that.
Thank you.
Well, thank you very much. I'm sure there's probably a few tag-along questions. I'm going to invite folks who have questions that they think of later to let us know, and we'll get in touch with you. But it's been great to have this conversation and to have so much information. I'm kind of glad we're recording it. I think I'll watch it again just to keep up with all the information. So thank you very much, and we'll let you get on with your day. I'm sure you have many things to
it's never
do.
boring at PCHS.
Well, we really appreciate it. And if there's anything the league can ever do when your boss comes up with these brilliant ideas to expand something, we're very interested in access to affordable care, and we're happy to support that.
And
So,
as you
thank
know,
you very
I mean,
much.
I have to tell you that I have to say that that's our main mission, is access and quality care. So I'll let her know. Believe me, she'll find you
All right.
if she needs you. All right. Thank you.
Thank you. Thanks.
Take care, all. Please stay safe.
Mhm.